For us beginners, this is a very basic question. In pathological cases, there is hardly any state, and there is really a very positive of symptoms. So what will be the approach of the case taker?
Palliation in homeopathy. So suppose the patient is having a non-alcoholic cirrhosis of liver. So, and the doctor said, allopathic doctor said that just 2-3 years are left for that. But the patient don't have any symptoms. Just by the sonography we are coming to know that the day by day the liver is shrinking. In that case, we can do something through the homeopathy.
Question that pathology like this where there are degenerative, in those cases, what can we do? Right? Go ahead. Go ahead.
Pathological cases with multiple foci. Lot of pathologies at different
cases like tuberculosis, and most of them in senior citizen, young children. What do we do with them?
How can we know that we are going in the right direction with our treatment?
So usually with patients with very multiple pathologies, they come to you last to a homeopath. After going to the oncologist, after getting like no hope, especially homeopathy is the last sort of hope, where they expect. So in such cases, the patient has already undergone multiple treatments. So his original picture of a disease is unmodified, is already modified. And in that case, when he comes to us, he comes with some few symptoms. So how are we to get the original unmodified picture of a disease? In cases, the patient has lost hope for the life, and also how are we as a homeopath, apart from treating, how to counsel him or how to manage such patients?
Cases, when and how do we use 50 millisimal scales?
We'll see. We'll find a real logic. So posology.
So how to assess the prognosis in the follow-ups?
So we will call this as integrative, synergistic, holistic approach in deep irreversible pathology. That universal law, that what is true for one part of the system has to be true for every other part of a system if it is based on a law of a nature.